The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, big topic, what you need to know if you're considering dental implants. My first guest says, now we're in an age of no more dentures. And he is a periodontist, Dr. Levine. Dr. Levine, welcome to the program.
Randy, it's good to see you.
Before we get into today's topic, tell me a little bit about your practice and what are the different procedures you do?
Well, we've been in our office in Tamarack, Fort Lauderdale, the same office for the past 34 years.
Okay.
Things have changed. When I first began my practice, we emphasized the treatment of periodontal disease or infections of the gum and bone. We still do that. We treat it, in fact, today many times with a laser. But we also are involved in cosmetic procedures. We treat people who have gummy smiles, people who have gum recession. We treat patients who are missing one, some, or all of their teeth. We do this in a very caring and personalized manner. We see one patient at a time. We respect our patient's time. What's so incredibly gratifying to me is that we can change people's lives. We can take someone who has an unattractive smile and make them attractive. We can make somebody who has gross disease in their mouth and make them healthy. I want to tell you a story about Grandpa. In 1985.
This is your grandfather?
Yeah, well, actually, my wife's grandfather, but Grandpa, he was my grandpa. He had been wearing dentures for 30 years, and he had a lower ridge like this tabletop. I had sent him to 2 denture specialists. They couldn't do anything for him. I came back from my first implant course, and we put just 2 implants in Grandpa's jaw. He had been losing weight, wasn't able to eat. Well, I can tell you that with just 2 implants, we gave him a denture that snapped in, and I can show you a model of that.
Yeah, let me see this.
This is not.
Is that right? I mean, just 2 implants?
This is 2 implants. Now, sometimes 4 is better, sometimes 6 is better. But for Grandpa, we put in 2 implants, and we changed his life. He was able to eat.
Let me see this. And this was your first case?
First case.
Okay. Were you nervous a little bit?
Well, you always try on a relative.
Yeah, was that right? Okay, is this accurate, though? Because I'm not, my hands aren't even greasy. I can't even take this off.
Let me show you.
Hold on a second.
Okay.
There's got to...
What you do is you have to grab it that way.
So that is accurate.
So this is very similar to Grandpa.
Interesting.
He had 2 implants put in, and the restorative dentist made the adjustment in his existing denture. He didn't even need a new one. And we were able to give this a snap-on.
So that would be a lower?
This is for lower.
So 2 implants.
Correct.
Snap in, snap out.
Snap in, snap out. Now, if we have patients who have available bone or we can build bone, we can do more than 2 implants.
Okay.
And on
what can they eat, by the way, with 2 dental implants?
Yes.
How soon can they eat, and what can they eat? I mean, could they eat a steak with something like that?
Grandpa ate a steak. You know, he didn't eat a tough steak. He ate a tender steak, and Grandma loved cooking for him. She had lost interest in cooking, but he was able to eat now, and she was very excited.
So no more adhesive in that particular case?
No
Not even
adhesive.
on the back?
Not even on the back. I can tell you that if patients want to are anticipating losing teeth and not doing anything about it, they should put some denture adhesive in their mouths, because it's disgusting. It's gooey, it's gross, and it harbors bacteria. But with the ability to place in only 2, we can change their lives. And I saw it personally. We use growth factors that enhance the healing. We withdraw just maybe 20 cc's of their own blood, get the growth factors out.
You can build bone? Is that what you're saying?
We can build bone. We can use it for soft tissue healing. You mentioned building bone.
Yeah.
You know, years ago, patients were told that if they needed to have bone built, they had to go to their hip. We have a multitude of materials that are available to us now that I open up a package or open up a bottle, and with different techniques, we can build bone without having to go to other parts of their mouth or other parts of their body.
But, you know, you mentioned, and backing up for a moment, that some of these patients are, 80 and 90. You even said 100. I mean, can a person that old can go through the process? It seems like they would fall out or something.
You know, 25 years ago, I took care of Grandpa, and he was 85, and he used those implants until he passed away. He was 93. But I want to tell you about the uncle of my orthodontist, Uncle Nat. Uncle Nat had been wearing a removable partial denture forever. And what I'd like to do is show you what that partial denture did to his mouth, and then show you what we were able to create for him. So this is Uncle Nat.
Oh my goodness, that's terrible.
And what you can see is that in his mouth he has 6.
What is that? That's the bottom?
That's the lower jaw.
Is that common though, something like this?
You know, Randy, I practice in Fort Lauderdale, Florida.
Okay.
It is very, very common.
Really?
Patient, you
don't see that though.
You don't see it because people are not smiling. They're ashamed of their smile. They're ashamed of the dentures that may be loose. But this is what happened to Uncle Nat. Uncle Nat had 5 remaining teeth, and on the outside you can see what he has, but on the inside you can see how the partial denture destroyed all the gum and bone holding those teeth. Uncle Nat, I think, was 87 years old. And we have pictures showing that where those teeth are, the only place in his mouth that there's bone.
So that's his x-ray, okay.
Right? And this is a side view to show that he really didn't have any bone there. The bone that he had was like a bouquet of flowers, so it was an illusion. So what we were able to do for him is place just 3 dental implants.
Okay.
We placed 3 dental implants.
That looks painful, by the way. You say they don't complain about pain.
I'm going to tell you what he told me.
Okay.
And he wasn't shy about complaining because he thought his nephew should have paid for his work. But he came back 2 weeks later and said, Uncle Nat, how did you do? He says, I took 2 Tylenol.
Is that right?
2 Tylenol. Now, 87-year-old guy's pretty tough, but he only took 2 Tylenol, and that's not uncommon. As I said before, 95% of our patients go to work, and 92% of them don't take
Okay, so what
any
did you
pain.
give him after that? Okay, so
What he got was an attachment that went inside a denture, as we see here, and in his case, the female part of the attachment went inside the denture.
that's underneath the denture, what I'm looking
Under
at
the
right
denture,
here.
right there.
Okay.
And here he is with a smile.
87 years old.
Well, you
and
know-
he can eat and chew? I mean,
You know, in Florida, a lot of our senior citizens are single,
okay.
and their social life is very important to them.
All right.
So they go out at least twice a day to have dinner. And they go out after that to resume their social life as they used to. Okay, I don't know how you want to say it.
Interesting.
Okay? And, you know, if they don't have the support of this, people excuse themselves from dinner. They have a loose-fitting denture. They have to go into the restroom because they have something caught underneath there.
Is that right? Did they tell you that?
When they come in, they say, you know, I said, why are you here? What can I do to help you? They said, well, I'm out, I'm eating, I'm uncomfortable, I'm dating. I don't want my date to know that I don't have teeth. So this is a very important part of their life.
Is the future of dentistry where there will be no more dentures, that people will have something to support? I mean, is that your vision? You think it'll go there one of these days?
I believe that that's here now. Now, it's not going to be available to everyone because people have to be able to walk into the dental office. And my goal is to let them know that these things can be accomplished for them with literally no discomfort. They can walk out of our office, they have minimal swelling, no post-op bleeding, and they can come back and general
So you
dentist.
work with their dentist. That means there's 2 people involved in this,
There
right?
are 2 people involved. They get my surgical expertise, and the dentist makes their beautiful teeth.
Okay.
And certainly, they get the best of both worlds.
You know, it doesn't cost more to go to a specialist like you?
Not really. In fact, I work with a lot of general dentists who do implants.
Okay.
And I help them because many general dentists like to drill holes and put implants and don't like to build bone. So with those dentists, I build the bone, I build the gum tissue for them, and then the patient goes back to the dentist to have the implants done. And I check. Our fees are not any higher than the general dental fees.
Yeah, you know, people will, and this is a real interview, and this is not an endorsement for you, by the way. I'm just asking the questions here. But people always ask me, no matter what it is, knee surgery, we get emails at wellnesshour.com, and I say, go to a specialist. You know, go to somebody that does this all of the time. That's my answer. I mean, do you have a certain amount of bias there that you think?
Well, certainly. I have
people should
patients that say to me, why don't you do the crowns on the implants? And I say to them, I haven't done crowns in 35 years. You don't want me to do that.
So you do the surgical part.
I do the surgical part.
Okay.
I do the surgical part. I build the gum. I build the bone. I place the implants. We can do procedures to widen the bone. We do procedures to lift up the sinus where their bone has been lost because the teeth were lost many years ago.
Okay.
One of the most common comments a patient says to me after, you know, is it uncomfortable? What's it cost? They want to know, I was told that I wasn't a candidate for implants.
Yeah, like they're too old?
Too old is one thing.
My mother was told that, by the way, 74 years old. Her medical doctor said you're too old for dental implants.
Well, you know, if the medical doctor says don't buy any green bananas, yes, then I wouldn't put dental implants in that patient. Okay. But as I said to you, we treat patients in their 90s. And I've done implants in patients in their 90s.
So it's about quality of life, more than just dental implants. I mean, eating, chewing, and...
Eating, chewing, going out of their apartment, socializing. There was a lady that I took care of, Ellen was her name, and she told me she lived in a condominium for 15 years. She had lost her teeth, and she hadn't been out with anyone in her condominium because she couldn't eat.
Is that right?
Right. She was a widow, And she was surrounded by widows. You would think they were all in the same boat, but she was so embarrassed by her inability to chew and look beautiful that she wouldn't go out. So what we did was we put in 4 dental implants for her, and a month later she wrote me a story about changing her life.
Is that right?
It was beautiful.
We're going to take a quick break. We come back, more about the process, what people can expect on day one, and the different options for denture wearers. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of Breathorex. Only Breathorex has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription Breathorex from your dental hygienist and now at fine stores everywhere.